Hi there and welcome to Thinking Out Loud. I'm Sheldon McLeod, and this is a chance for me to connect with you here at SaltWire.com. And don't forget to search out our SaltWire YouTube page. It's fairly new, and we'd love for you to join the conversation, click the bell, do all those things so you can keep in touch with us for the latest videos and information. Now, I got a news release. The news release landed in my email box telling me that it was National Diabetes Awareness Month, and they wanted to make me aware of something that was taking place. So what is diabetes? We see the importance of insulin, the types of diabetes 1 and 2. The reason that these folks were reaching out to me was because of a trial that's underway. There's a team from Toronto and Vancouver that they believe they're pretty close to eliminating insulin dependence for early stage type 1 diabetes. And as they say, so far, an 18-month study, 2 people that step forward as volunteers no longer require any insulin. Now, they did ask a number of people to participate. The doctors are across the country, but one of the participants is here in Halifax. Andrew Beaver is joining the conversation. And Andrew Beaver, it's so nice to see you. Glad we can connect today.
Good afternoon. Thank you for having me.
I will start this conversation by asking about your experience, finding out that you have type 1 diabetes. Tell me about that.
Yeah, so my story of my diagnosis, it really goes back to last November. I did a blood test for an application that I was doing, and my glucose levels came back a little bit high. The doctor wasn't too concerned of it at the time. He mentioned how it's not diabetes, but unfortunately, he ended up being wrong. About 8 months later in July, I noticed I'd lost quite a bit of weight in a short period of time. I lost about 12% of my body weight. So I was a bit concerned and did a finger prick test at home because we have a glucose meter. And my glucose levels were about 5 to 6 times what they should be. So I went to the emergency room and they diagnosed me with that.
Now, did you have any of the other symptoms, classic symptoms of thirst and tired and those things that go along with people who are diabetic?
Yeah, I didn't really have any of those. Not that I noticed. Because a lot of people, they're tired. They go to the washroom all the time. They get very thirsty. But I didn't really have any of those. It was just the weight loss. So we caught it pretty quickly.
So did that mean you had to start taking insulin injections to treat or to manage your type 1 diabetes?
Yeah. So it was about 2 days later. I visited a diabetes specialist, and they put me on 2 different insulins, and I've been taking those 4 times a day since.
Now, that's got to be a big change to your lifestyle as a young man in his early 20s. How did that affect you?
It's very tough. It can be very overwhelming at times, especially at first. Yeah, there's times at first where it feels like your life is almost ruined. Although, at the time it's not. It's tough to shake those feelings off.
Got to think at some point, though, deep down inside, you're saying, okay, I'm losing weight, I'm not well, and, you might be thinking of the C word, cancer, as opposed to D word, diabetes.
I had a lot of experience with diabetes in my life. I have 2 cousins with type 1, and then my father has type 2. So we kind of figured it would be type 1 when we did the finger prick test. Mm-hmm. But those thoughts definitely did come to mind. Yeah, I'm not totally sure about how pancreatic cancer can affect your glucose levels, but that's something that definitely comes to mind.
Now, I was told about the study that's underway and, how some folks are finding some benefit from it. How did you, first of all, hear about this medical trial?
There was, in October, there was a conference called the No Limits Conference. And my diabetes specialist, she told me to, if I was going to listen to anybody on it, to listen to Dr. Perkins, because he's a very brilliant mind in the space. He also has type 1 diabetes, and he's one of the principal investigators in this study. And he just mentioned it briefly at the end. He said they're looking for people between 18 to 35 within their first 100 days of their diagnosis. And I was just on the cusp of the end of that, so I emailed him and told him my story. And I got in contact with him there, and then I ended up going to Toronto but 4 days later.
Right. So you talked about Dr. Bruce Perkins. They tell me he's director of the Leadership Sinai Center for Diabetes at Mount Sinai Hospital, heading up the Toronto arm of the study. So all of this to say, he brought you in, or you met the team, and they said, we want to give you this medication. Is it a pill you take? Tell me what it is that you're on.
It is an immune suppressant. So the first time they give it to you, they infuse it just right into your arm, into the bloodstream. And then after that, about every 8 weeks, then it's a needle that goes into. There's a 2 in 3 chance you end up on the drug, and then a 1 in 3 chance you end up on a placebo.
So at this point, you've been on this for several months. Do you know yet which one you're taking?
I've actually only been on it for a week.
Oh, wow.
Yeah, I just went. I first began the trial in November 1st. I went for a screening, and then 2 weeks later, I went back for the first infusion. So I haven't noticed too much of a trend yet, but I'm definitely hopeful that I'm on the drug and I might see some great improvements, like you mentioned earlier.
This is a drug that is usually used for people who have psoriasis or have Crohn's disease. So as you say, this is about your immune system. This is about trying to help your body not fight itself. What's the goal here? What would be the best outcome possible?
Yeah, the best outcome possible would definitely be to be able to come off insulin. That's definitely a dream to have. To stop the immune system from essentially committing treason on your energy levels.
And I guess the other side of it is the likelihood that if it isn't effective, you might end up being required to test and treat yourself with insulin for the rest of your life?
Yeah, that would likely be it. Yeah, there's always new studies on the way, but then I would just be like the rest of the people with type 1 and just be treating it like I've been.
So how does that feel, knowing that this could very well help you in this way, but you won't know until after the study whether it's not effective or if, in fact, you've been given the placebo?
I do think the future of this is important. That's what I think that should be why somebody does a study like this. Yeah, there's definitely for yourself, like the self-improvement of it, of someday hopefully being able to come off insulin, but it's more about the future generation, to help them, just like the last generations would have done for me.
And I don't know what kind of job you were applying for, and I'm not quite sure how you would describe your personality. There's a risk-benefit analysis that has to happen from a clinical side, but even as a personal side, going into this with the hopes, but I don't know, where were your expectations?
I do have some experience with this drug. It's a drug called Stelara. My grandmother actually takes it. And I do know that it's a fairly safe drug. It's used for, like you said, other autoimmune conditions. So I'm not too worried about the side effects. It's just the plus side would just be so much better. That hopefully it does help the people that take it.
And how long do you have to wait to find out? How long is the trial?
The trial is 18 months, but since they are still taking people, I believe their estimate now would be 2024 is when I would know for sure. Mm-hmm. If I end up on the drug, I would probably end up noticing lower glucose levels and being able to come off the insulin.
And how are you feeling today?
I'm feeling good. Yeah, it's always a roller coaster with diabetes, but I've noticed a bit of improvement since then.
Well, it is obvious that medical researchers are often, looking for that next, perhaps, miracle drug, or in fact, a new application for a drug that's already been approved. Perhaps that helps, because this is a drug that may not be approved necessarily off the shelf for this type of condition, for treating diabetes 1, but it's still a drug that doesn't have to be proven to be safe.
Yeah, exactly. It's an already proven drug.
Right. Well, Andrew Beaver, we'll have to keep in touch to follow your journey throughout this. I won't say adventure. This is your life. This is a definite, impact on your quality of life. And we've come a long way with treatment of diabetes, but it feels like, or it would seem to an outsider, it would still be intrusive on the way that you live your life, and watching your diet and making sure you keep an eye on your blood glucose levels.
Yeah, absolutely. I mean, just 100 years ago, they just started giving insulin. Before now, 100 years ago, it was terminal condition. It's come a long way.
Well, Andrew Beaver, thank you for carving out some time for me today, for agreeing to this interview and to this survey, and sharing with us your experience so far.
Thank you so much, and thank you for spreading awareness about the study.